Hello, I'm Dr. P.J. Mazumdar from Arogyam Hair Transplant Clinic. So today we are going to discuss about beard transplant, beard and moustache transplant. So usually both occur together. So this is a very common form of transplant. Next to hair transplant, we do the maximum number of cases of beard and moustache transplant. So today I'll discuss in short the entire process, the results, etc. and everything that you need to know about this. So what we do in beard transplant is we put the permanent hairs from the scalp into the areas which are deficient of hair in the face. So usually we will do it in people who do not have the desired amount of beard or the desired amount of mustache. So we plan out the area, then we make the slits, and then we take hairs from this permanent zone. So the permanent zone contains hairs which will last lifetime. So we take out these hairs one by one along with the root, and then we plant it into the facial areas, and there it will grow lifelong. So it looks just like a natural beard. There is no difference. The beard can be shaven, it can be cut, it can be colored, and it can be shaped in exactly the same way as a normal beard can be done. So the shape of the beard. So that can be decided by the patient and by the doctor. So we discussed thoroughly with the patient as to what needs to be done, as to what amount of beard that he needs. So generally the most often what we do is this French type of beard. So people who do not have the beard here and maybe only a few hairs in the mustache area. So we plant in the mustache area, we make it through here, we draw it here and then around this part. So that will take about 3000 grafts. So that is the most common area that we do. Sometimes people do have a lot of hair but it is deficient in some areas. So in that case we just cover up those areas. So in that case lesser amount of grafts will be needed. So in that way this is partly by the patient's choice and partly by our choice also. We discuss thoroughly with the patient and accordingly we do the whole thing. So the number of grafts that will depend on how we have drawn the area. So if we are going for a big transplant, we extend up till here and the patient also has very little of his own hairs in the beard area, in the mustache area, then the case becomes larger, a larger amount of grafts will be needed, say 3000 to 3500 grafts. But most commonly we can usually finish this within 1500 to 2000 grafts. So all that we take from here and we plant here. So the donor area in beard transplant is the same as in any hair transplant. It is this permanent zone at the back here. So in this area, as we know, the hair is permanent. That is why we choose the grafts from this area, and when we plant it here, here also it will be permanent. Since we do not need too many grafts, generally around 1500 to 2000 and rarely up to 3000, there is no change at all in the donor area. Planting in beard transplant is the same as in scalp transplant, as in the transplant we do normally in the hair, in the head. So here also we use the choy implanters which protects the grafts and which gives very good results. And we can also adjust the direction and angle very accurately. The only difference is that in beard transplant the angle is very small. The beard has to remain flat against the cheeks, and so we have to plant at a very low angle, almost perpendicular to the skin. So that can be achieved quite easily with the choy implanters that we use. So next, when we consider the age of the patient, we do not do beard transplant before the age of 21. That is because till 21 there is still a good chance of the hair coming. So puberty in males is finished by 17 to 18 years. But after that also there is always a chance of the hairs coming, of the beard hairs growing after 18 also. But generally by 21, 22, whatever hair would be coming has come already. But after 21, we generally do not expect any fresh beard growth. So if somebody has insufficient beard at that age, at the age of 21, then only we go for beard transplant, not before that. So the quality of the grafts in beard transplant is the same as in scalp transplant. But only difference is that in beard we generally choose single and double hair grafts. We do not go for a higher number of grafts like 3 hair or 4 hair. So the single hair graft we use at the edge to give a natural look. And in between we can give both single and double hair grafts. But generally we have to avoid 3 hair or 4 hair grafts because it might look a little too bulky. So another thing is about infection. People do tend to worry a lot about infection, but infection is actually quite low in the beard area. The facial area has very good blood supply. So infection chances are in fact lower than scalp hairs. So infection is not a problem at all for beard transplant. So pain in beard transplant is also not a cause for concern. Pain is actually not so high, not so severe. People generally think that because it is the face and it is a sensitive area, they would have a lot of pain, but it is not true. We give local anesthesia and we have found that all patients could bear the pain very easily. It is not so severe, not so concerning, not a factor to worry about. So another thing that people do ask a lot is treatments to bring their hair back, medical treatments without procedures. So that is not possible. There is just no treatment for beard hair. So things which work on the scalp like minoxidil or finasteride do not work on the beard. There is no treatment actually for beard to make the beard hairs grow. So coming to the results in beard transplant and in moustache transplant is very good. As I said, the facial area has a very good blood supply. So we expect a very good survival rate for the grafts in beard and moustache transplant. And we almost in actually practically in every case we have always seen very good results in beard and hair transplant. So coming to the price of transplant, so that can vary. So generally the price per graft in beard transplant is higher than in scalp transplant. So the price does tend to be a bit higher, but even then it is not so much high. Generally you can expect a price between 60,000 to 80,000 rupees, but it can be more than that, and it might go up to a lakh in big cases, might go up considerably more than a lakh in big cases. But generally that is the level you can count on. So in conclusion, I would say that Arogyam hair transplant clinic has been doing beard and moustache transplant since a long time. We are the first clinic to do these transplants, and even now we are still the largest clinic doing these transplants. It is a very common procedure for us. So if you are interested in it, do come to a clinic, do show our doctor. Let me see. I can discuss with you how many grafts you need, what would be the price, and everything else that you need to know. So come for an appointment, call at the number below, and let us see how we can proceed with your case.